Now joined by Rui Barbosa of DevScope, who gave what can only be described as an enlightening presentation on Devital. Rui, you're very welcome.
Thank you very much. It's a pleasure for me to be here, especially in a beautiful place like Mollingard.
Absolutely. Vital, what is it in a nutshell?
Well, it's a system that early detects signs of clinical deterioration. It's like when you are driving the car, it will warn you to hit the brake before you actually hit the brake. So if you put this into health, it will detect some future problems that you have before you have them. And that will help clinical teams to prepare and circumvent what will be the causes and the problems that we'll have in the future, so that they can act earlier and, of course, better efficiency, lower cost, and improve your patient safety in global terms.
And by the sound of it, from a technical point of view, it's probably the greatest invention since the internet.
No, that's a huge way to put things, but we did win the Microsoft Innovation Award for this solution. It's a very prestigious award. It is targeted to companies that create innovative solutions, and we won that. And we also won the IT Europe's Best Solution Award for 2014. So it's quite a revolutionary system, that's true, but the biggest innovation since internet is a bit too high. So,
well, when you think of some of the other internet, there are apps that can kind of play little songs. You have developed a process that literally can save lives.
Yeah, that's true. But we need doctors to validate this concept. So it's a situation where we are dependent on the results, and we don't try to substitute no one. So we are just a system mechanism to try to trigger things and to try to warn possible signs of problems, future problems, based on historical medical data.
Now, what are the symptoms that it analyzes?
Well, I can't be completely I can't answer you to that directly, because we have more than 500 KPIs, 250 million records processing every day. So we analyze a lot of data, a lot of formulas. So, and we analyze correlation between those formulas. So actually, it can trigger a lot of things. But we work together with the hospital university, and they created a lot of rules that when those rules hit, then it will be a potential problem. And they have severity levels. So when any of those rules are hit, and if, for example, a blood sample is too high, it can be triggered by different kinds of problems and diseases. But that's up to the doctor to decide. I'm just going to warn them that that level of that substance is wrong, and it's with that progression or decay, it will possibly be a life-threatening situation, and it needs to be taken care of immediately.
So it's quite a complicated system. It's not a simple case of analyzing your blood test, analyzing your ECG, analyzing your heart monitoring. You're analyzing and monitoring everything, but you're also cross-referencing against each other.
Yeah, not just that, we are analyzing in real time. So every 5 minutes we analyze all the data coming from all the equipments of the hospital, and we cross-reference with all the information in the past and what were their outcome of people that have those symptoms. And we use techniques of artificial intelligence and machine learning so that we can predict patterns out of data that are not like just simple visible to the human eye. Of course, an experienced doctor will figure that out, but it's I would like to be in a place where more false positives exist that can somehow increase the patient safety. And if a warning is said and the doctor realizes that that's not a big deal, that's okay. But the problem is, if something is bad and we don't target anything or alert something, and that will be a problem. So we prefer to play, to inform, and to trigger more alerts, knowing that sometimes some of them will be false, then that just don't trigger alerts at all.
Now, for a hospital to take Vital on board, how computerized do their records have to be?
Though actually, they don't have to have a lot of computerized. All they have to do is plug systems, vital systems, to our technology, because we are not creating our rule set based on their electronic records. We already done that with the database that we have from the hospital where we work with. And what we created was a model. So a model is basically, in basic terms, a combination of variables, formulas, and aggregations between them. So we already have that. So once we have data feed coming in, those formulas will produce results. So it doesn't have to, the hospital doesn't have to be highly informatic dependent and get a lot of electronic patient records. All we have to do is start feeding it with the readings that the machines are making. And today, in today's world, those machines produce a lot of data. And the same machine that reads blood analysis is the same in Portugal and the same in Ireland or everywhere in the world. So we just combine all those data, and based on the things, we trigger alerts to doctors based on the severity of what to consider a life-threatening situation that needs immediate attention or not.
Now, it was developed in Portugal and it's already on trial in a hospital in Portugal. How are those trials coming along?
No, actually, we have a 2-year development, 1 year of trial, and now it's in full production. So it's not just a pilot, now it's working full time. So we didn't want to go public with this until we had a confirmation that it was a stable and working software. And also this has the brand of the Portuguese hospital called Hospital São João. It's the biggest hospital in Portugal. It's been getting a lot of awards. And they also wanted to release something that it was actually tested. So we tested for 1.5 years, actively developing stuff, but now it's working and it's not a pilot anymore, it's under production there.
And the hospital, how are they reacting to it? What feedback are the hospital giving you about the product?
Well, the feedback was very, very good, and they are very happy with that because they have a system that can potentially save lives, anticipate problems on their units. So it's a complementary diagnostic mean to improve the quality of the hospital in terms of cost reduction, in terms of patient safety, and in terms of global operation of the hospital. And that's why the hospital has been, over the last years, the best managed hospital in Portugal, even though the government is always cutting funds from them. So they are getting inventive ways of increasing their efficiency with less money, and this is one of the things that they are using. So the response from them is overwhelming, and one of those things is I received 2 text messages from the clinical corpus of the hospital saying, I just want to tell you 2 words, thank you very much, because it actually detected some situation that they were not aware, and that's very comforting to have those kinds of messages.
Well, it's great to know. Now, you're partnering with Midas here in Ireland. Is that part of what will eventually be a worldwide launch?
Yeah, we hope so. We hope so. The idea is Midas is in Ireland. They are very well launched to be a successful company. We have the technology. We are a technical team, so we don't have the resources. It's not the resources. It's not in our core system to promote this in terms of commercial. And I believe that Midas has everything that is needed to push this into Ireland. And as they have connections to Nordics and the UK, it could be a spread from Ireland. And as Ireland was it was our choice because we share the same values, we are in the same time zone. There is a very good connection, communication, transportation network between Ireland and Portugal. So it sounds like an obvious choice. And English is also very interesting because we are fluent in English, and we get along very well. And the people in Ireland are very nice, and very pragmatic, and we like those kinds of approaches.
Well, Rui Barbosa, thank you for your time. Congratulations on your products, and welcome to Ireland.
Thank you very much. It's a pleasure for me having here, and thank you very much for all the attention that you gave me and the opportunity to show our technology. Thank you.